Bismillahirrahmanirrahim. President CPSP Professor Khalid Masood Gondal had a busy week before Eid al-Azha. The schedule started with the weekly meeting with all heads of departments of CPSP headquarters, attended by the local council members, including Treasurer CPSP Professor Masroor Ahmad, Professor Abdullah Muttaqi, and Professor Abbas Maiman. Besides the feedback session, weekly implementation plan was updated by the heads of departments. This was followed by the Zoom meeting with the fellows working at the districts for consideration of the accreditation of district hospitals, provided they meet the CPSP criteria. On Zoom meeting, Director General Health Punjab Dr. M.GONDAL and Minister for Health Punjab Dr. Jamal Nasir specially joined to support training program at district hospitals for quality patient care. In the afternoon same day, the President had a meeting with the selectees of junior and senior fellowship programs for UK. This Zoom meeting was also attended by the council members from Karachi, Director General International Relations Professor Asghar Butt and Director General Medical Education Professor Amir Zaman Khan, joined from Region Centre Lahore, and Senior Vice President Professor Mohammad Shoaib Shafi joined from Region Centre Islamabad. It is worth mentioning that CPSP initiated a postgraduate overseas rotation program in collaboration with Health Service Executive of Dublin, Ireland in 2013. And so far, 566 postgraduate trainees have availed these schemes in 10 different specialties. These trainees go there in junior fellowship program after passing intermediate module examination and occupational English test or IELTS test. They have worked there for 2 years and they have to come back to Pakistan to serve the people of Pakistan. WHO has given this scheme the name of Brain Gain and not the Brain Drain. The details of this scheme are given in the link in the description of this video. Currently in UK, junior as well as senior fellowship schemes are in 30 plus different disciplines, and 474 doctors have availed the scheme in 5 different hospitals, namely University Hospital Birmingham, Walsall NHS Trust, Leeds Teaching Hospital, Hulls and Yorkshire, Dudley Group of Hospitals. In current Zoom meeting, a total number of 80 selectees for year 2023, in which 44 in the senior fellowship programs and 36 in the junior fellowship programs participated from different region centers under Karachi, Islamabad, Peshawar, Quetta, Multan, Abbottabad. And on request of most of the candidates, the Zoom link was shared to them to attend this very important meeting. President CPSP Professor Khalid Masood Gondal briefed about the history of CPSP's overseas rotation program, followed by the address of Senior Vice President Professor Mohammad Shoaib Shafi, Director General International Relations Professor Mohammad Asghar Butt, and Director General Medical Education Professor Amir Zaman Khan. Also, Treasurer CPSP Professor Mohammad Masroor, Council Member Professor Abdullah Muttaqi, and Professor Abbas Maiman. The Program Director of Dudley Group of Hospital, an eminent vascular surgeon, Dr. Atikur Rahman, while addressing the participants, specially stressed upon the soft skills, including the professionalism. While mentioning the details of the program, he said,
I'm a vascular surgeon and I'm Director of Medical Education in my hospital. And obviously, I look after the CPSP program in Russell Hall Hospital in Dudley. I was there. I think the key is 2 things. One, that the people who go, I find in medicine, more or less they are very satisfied because they get the good experience, whichever specialty they are, because they get a lot of experience seeing emergency patients, dealing with them, and all of that. Some of the challenges, Professor Gondal and Bhatt said, the challenges in surgical specialty, because I think the people feel over there we don't have enough hands-on experience. I think what I find always, and I tell all my trainees in my hospital, it's not about the operating. It's not about, of course, if you train anybody to operate anything, I'm very confident they can do that. They have to be competent and capable. They can do that. But the biggest thing, the biggest challenge which we learned when I went there at a very young age, was how do you look after a patient pre-operatively, how you get the patient set for theaters, and how do you look after a patient post-operatively? Because those are the most important things really which you learn. So that's the one thing. The other thing is the soft skill. When I say about the soft skill, is the communication skills and about the management skills and the leadership skills. I think those are the key area where that's what you learn. And if you ask most of the trainees who went across to England and what you learned, and they say, after 2 years, what I've learned, how to communicate with the patient, how to respect patient, how to respect their values, and how to really listen to the patient. And those are the key things which you cannot really learn most probably here. The couple of other things which I really tell all my trainees when are there. The one thing is, please do learn to say thank you. Okay, you will never realize, how important that is to say thank you to anything. Okay, so once you say that, it's become so easy, and so so many things get done very easily. That's the one thing. The other thing is, please learn to say sorry. Do apologize. If you have made a mistake, if you have done something, just simply say, I'm sorry. And please admit that. Never ever try to hide your mistake. Every human being is, capable and can make a mistake. Whoever that person is, whoever, we are all here and we can always make mistakes. Okay, nobody can say, I never made any mistake. But if you made a mistake, please do not try to hide the mistake. And that's what my other message, which I always do give to my trainees, and that's what we have learned from what happened, because this is a normal practice. The people go from here, and if something has gone wrong, and they say, oh my God, what's going to happen? And they try to hide things. The moment you try to hide things, that means a disaster. Okay, so the simplest way is to say sorry, this is my mistake, and I'm going to learn from this, and I'm going to reflect on this. And honestly, these are the golden words. If you use these words, everything will be sorted. Nobody will ever question you. In fact, they will admire you. You made a mistake, you had admitted it's my mistake, and I haven't tried to blame anybody. Please do not try to say, it wasn't my mistake, somebody else did it. Please forget about this, somebody else did it. No. You are never supposed to say that somebody else did it. Even somebody else did it, don't say a word. Just be quiet. Don't say and don't blame anybody. This is absolutely important. So these are the few things really. Once you learn that, honestly, you can learn the whole 2 years and you can live there without any problem. Say thank you, say sorry, do apologize, say I'm going to learn from this, and say I'm going to reflect on this. And those are the things which really will be so successful. It took, as Barsab said, we belong from a religion, we belong from an area, where these old values and was taught to us most probably 1400, 1500 years ago by our Prophet. Be honest, be reliable, be trustworthy, okay, and never lie. And these are the values, I can tell you honestly, which matters there. If you follow this, you will never be got into any trouble. I can tell you that. So those are the simple, I would say, the golden word. You got to use it. So the other things which I always find you guys, which you need to learn is, as again was said before, be respectful, be very civil, and never try to have an argument with anybody. You are really the true ambassador of the college. The other things which is the relationship. The relationship with your colleagues and relationship with your nursing staff. The nursing staff, remember one thing, I'm afraid then I really don't want to repeat these words, because in this country, I don't know, I haven't worked here for many, many years, but everybody is equal over there. There is no nurse, there is no doctor, and there is no clinical support worker, and there is no sweeper. Everybody is the same. Whether you are a doctor, whether you are a cleaner, and you have to respect them. And the other thing is about the annual leave. Please book your annual leave in time. There is always a set rules and regulations about annual leave, and that is absolutely important. We oblige in my hospital, we oblige the same annual leave as we oblige to any other trainees, in my hospital, which is in my hospital, the 28 days of annual leave, and that's get my trainees, the local trainees, and all the other, the trainees, the MTI get the same 28 days per annum. That's the working days I'm talking about. That's the annual leave. And then there is leave, the study leave, and there is obviously some professional leaves as well. Because in my hospital, I get the trainees get engaged to leadership and management courses, so they get that little bit of training and annual leave there as well. Apart from that, study leave, annual leave, I'm afraid there is no other leave which we can afford to give to anybody. Because again, a lot of trainees in one of the department, when you are in your department, wherever you are, please do speak your English language. That's the language over there is English. You have to speak English, and is absolutely important. Get your registration sorted right the way you go there. Don't wait for a year to get your registration. Just know the RTM numbers and all that. So that registration should be sorted. Your supervisor needs to be allocated, and let's go there. When you get there, of course, we welcome you. We got the whole big induction program. This is an excellent opportunity for you guys. You had, I would say, again, the word ambassador. You are there, and we most welcome you. And I would say thank you very much for your invitation and for the council invitation. I really, as I said before, it's a privilege. And I really feel very honored and to talk to these trainees, number first, and then obviously to the council. And I'm very thankful. The only thing I have to add is the prayer. You mentioned Professor Shuaib Shafi. We do have a Friday prayer. Would you imagine? We have 3 Friday prayers, and on every prayer there are about, I would say, 40 to 50 people join, on Friday, and you will realize the people who are in Russell Hall, and same applies to UHB and all other areas. So we do have our values, and please do not forget your values. And I said before, and the people really appreciate you, and whatever you say, they appreciate, and you should project, by your actions, not just simple saying things. Whatever you do, that's your action. And that's simply the way how you can be more penetrating and how you can be more influential, I would say, and that applies to our values. And the last thing was there's already a lot of quality improvement and audit and research program over there. So please join those programs wherever you are, in UHB or whichever hospital you are. Try to find the link to those areas, the research, audit, quality improvement. In fact, I had in the last 2 years 2 MTIs trainees who are our chief registrar. This is a great leadership program, and this program is developed by RCP, Royal College of Physicians, and our MTI trainees were, and currently our 2 chief registrars are, one is the cardiology trainee and ISIL, and the other one is I think a lady from Peshawar, and she's the chief registrar in my hospital. So those are the opportunities. But Khalid, thank you very much for your invitation, and it's been a pleasure.
The brief session concluded with a vote of thanks by Secretary CPSP Professor Ishad Waheed.
This has been a very enlightening session, I must say, and very informative for all our trainees who are going there. As all of the speakers have done a wonderful job of being very comprehensive about the work there and how to get by there. I must compliment Dr. Atik for his very illuminating talk about work there. And I can tell all the trainees that if you follow what Atik Sahab has told you, you will find the atmosphere, they are very friendly. Don't be apprehensive. Don't get tensed up. They are very friendly people, and they are very helpful people, provided you follow what Atik Sahab said. Now, there are a few things that I'd like to add, just a couple of things. There are some legal implications also of working there, so be careful when you, especially male doctors, examining the female patients, always ask a nurse to come and stand with you. And they will always do that. They are very helpful that way.
Followed by the group photo. Thank you.